Sorry. Yes, so coming back. So extravasation is because of vesicle drainage. Now, please remember the reasons for both are the same. Person doing insertion is not skilled, multiple pricks, vein is damaged. Now, if you do an infusion, it goes around. Second, if you are not securing the lines properly. Dressings have to secure that. If your dressings are not securing, there is edge lift, it becomes loose, moisture is trapped under the skin, it will come out, and the catheter also gets loose and dislodged. So then it will go into the surrounding tissue. Third reason is because of the catheter placed on flexion end. So if it is placed on flexion, movement will cause displacement, and then the catheter, the solution will leak into the surrounding tissue. Fourth reason is occlusion. Peripheral line occlusion. What do you mean by occlusion? Block. What will block the line? Blood or medication. So that is peripheral line occlusion or central line occlusion. Any lines can occur. So in this case, what you are supposed to do is, of course, prevent it. You're flushing it before, in between, and after every medication, and once in every shift if the line is not used. Okay, remember this. So this can also cause infiltration and extravasation because the fluid is not going anywhere. It will leak into the surrounding. So for infiltration and extravasation, there is different signs and different management. So what are the signs of infiltration? Swelling, correct. Pain, correct. Sight is cold and color is pale. Different from phlebitis. Phlebitis, it was red. Temperature warm. Swelling and pain is also present there. So this is what you need to remember. Very common complication in pediatrics and pneumonitis. Okay. Next is management. How will we manage? What we do if we have seen an infiltration? Stop the infusion and remove the cannula. Then reside on the opposite arm, if not contracted. Okay? If you are putting it on the same arm, away from the affected area. Then what do we do? Site is already cold. Elevation, yes. Magnesium sulfate dressing. Okay, for infiltration, magnesium sulfate dressing to be applied. Documentation.
Which code we have to put the starting use code also we can put the magnesium sulfate.
For
Infiltration.
infiltration, you can use magnesium. Yes, not cold compress. Cold compress for phlebitis, okay, not for infiltration. Okay, so we want to increase blood circulation so that solution starts draining from that system. Okay, so that's why we want cold compress will not help in that. And lastly, documentation. VIP score is applicable here. Can we document VIP score? Yes? VIP full form? Phlebitis. What are we discussing? Infiltration. So not applicable. Okay, come soon. Not applicable. Okay, so we do not do VIP incident reporting and documentation in your notes. Is important. Here with infiltration management. Okay, now we move on to extravasation. Now, whatever complication we just saw, phlebitis, occlusion, or dislodgement, or filtration, we remove the gap. Now let's move to extravasation. Now extravasation, how do we identify the signs and symptoms? It is similar to you experiencing birth, right? So the patient, what will the patient say if the patient has extravasation? Burning pain at the side. Then okay, warm, correct.
Redness.
Skin discoloration. Skin discoloration because the skin is getting damaged. So it will start with redness, it will become green, blue, purple, black. Right? Necrosis can also. So skin discoloration. Blister formation. Right? Blister formations and swelling. So burning pain, blister formation, swelling, and skin discoloration. These are the classic signs of infiltration. Phlebitis takes 6 hours to develop, infiltration takes minimum 4 hours to develop, and extravasation occurs in the first 30 minutes of infusion. Okay, so you have to watch for these signs. What do you do in extravasation? Stop and don't remove the cannula. It's the only complication where we don't remove the cannula immediately. We will aspirate from the same cannula, then remove the cannula, then mark the site. Antidote within 1 hour. An antidote has to be given within 1 hour of extravasation. Then cold compress, elevation because patient has swelling, and incident form to be placed. Can we document BIP score here? No. Okay, very different complication altogether. So what do we do? Do not remove cannula. Aspirate. Remove cannula. Malaria. Antidote within 1 hour. Documentation.
Incident.
Elevation and cold compress. Okay, please remember. So this was, we identified, we know how to manage. In addition, how we prevent. There are some guidelines given by INS and CDC, Center of Disease Control, 2017 guidelines and 24 guidelines. What does it state? When you prepare a patient for an IV cannulation, first thing what you're supposed to do? First thing.
Proper eye.
Assess.
Before assess. Before explain.
Explain.
Okay, before verbal consent. Before preparation. Before hand wash.
The file or the required drug.
Okay, before that.
Explain patient.
Counseling patient.
Before counseling. Before that. Before that. Huh? Before that.
कौन सा कैनुला कौन सा लेना है कैनुला कौन सा लेना है ये देखना
Before
पड़ेगा
that. Before that. Come quickly, I've come to the end.
Keep the patient comfortable.
Before that.
the side of inferior
IPSC goal. What is IPSC goal? International Patient Safety Goal. Identify the patient. Yes? Yes or no?
Yes.
Before everything, identify the patient is the important ingredient. It should be on the tip of the tongue. So, first thing is identify the patient, then you do everything. Assessment, observation, make patient comfortable, do everything possible. And on basis of that, you understand what is the infusion to be given to the patient. On the infusion, you will decide appropriate site and appropriate cannula site. So for that, which are the veins which you are supposed to choose for an IV cannulation? We will put on the trachea. Which is this vein? Metacarpal. Which is this vein? Cephalic. Which is this vein? Basal. Right? So these are the three recommended sites for vein cannula. But remember, metacarpal veins are very thin veins compared to cephalic and basal. And that's why you can do an insertion of a 22 to 26 gauge cannula for basic hydration and basic antibiotics, right? First generation antibiotics. But if you have to give blood, chemo, contrast, high-end antibiotics, and all of those type of medication, then cephalic and basilic veins are good to select. Because these veins are large veins with good blood supply, more straighter, more sturdy, because the bone for pediatric acts like a spring, and for geriatric it is less slippery compared to the metacarpal vein. So selection should be based on the type of infusion and the vein calculation. Okay, so that's an important point when you prepare an assessment. Also along with it, avoid area of flexions and have to ensure all of you are being trained on a regular basis so that you are able to take care of these lines more effectively. Now, selection of the vein gauge, small gauge. I've already told you So flow rate, look at the packaging, flow rate is always mentioned. There are mostly three types of cannula movements, 22, 20, 24 or 20, right? 22, 24, 20. 18 is very rarely used because your patient veins are not that big. So these three will have a definite flow rate. So you get an approximation on which vein you can use this cannula. Clear? So this is it. Now, articles prepared, you have been ready to take the consent, verbal consent, document the verbal consent. Patient has said okay to do an insertion, and now you are going to get the insertion. Always prepare the non-dominant hand, right? Non-dominant hand to do the insertion. Once you are done that, you apply a tourniquet on the insertion site, right? 4 to 6 inches above the insertion site, and then you dilate the veins. Vein dilation is important to get a right insertion access. Then you disinfect the site with chlorhexidine solution. How? Circular movement from center to periphery. Center to periphery, why? So from center is the area where you will use the bridge, so we have 19 meters there. And second reason is from center, by the time you come to the periphery, the center dries. You have to allow the solution to dry, otherwise you will have chemical complications, right? So once you have done that, how many attempts are you allowed? 2? 2 per nurse, 2 per patient. How many attempts? 2 per nurse or 2 per patient? 2 per patient. Here everybody, right? So it is not 2 per nurse. So important. How many? What is the objective? Actually, to do it in first. Though we have 2 chances, what you should be your objective? An aim and objective should be 1 brick. I should be able to give that insertion, right? So what's the level of confidence you should be having to do that insertion? 200. For 2 reasons. Firstly, you want to do it in 1 brick. Secondly, when you do a disinfection of that insertion site, what happens? For some reason the vein disappears. And then what do you do? Disappears or no? Yes. Then what do you do? Go back to, because you are wearing clean gloves, you are not wearing sterile gloves. To go back to touch that site and it is okay. You are disinfected, it has to stay disinfected. So no touching that area, so that's why take time to dilate. Okay, if you are having more challenges, if you have a vein finder, use a vein finder. Okay, so that's important. Technology is available. Don't contaminate the site. Your patients are already immunocompromised. You can't say where the patient can get an infection from. Peripheral line can be one of the sources. You think it is a very small, but remember it's invisible. Okay, so that can lead to a bloodstream infection. So please don't do that as a part of your septic. Next is securing and protecting. I told you any cannula, any central lines, any catheter, securing is very important. Because securing helps to maintain the cannula and protect the cannula from external environment. If you don't put a dressing on a cannula, external environment microorganisms can enter, right? And that's why you're using a transparent semi-permeable. Why semi-permeable? Moisture from the skin should go into the environment, but environmental moisture and contamination should not go inside. So that's important to know. So hence securement is very important. It has to be such a securement that it does not come off easily, does not lift. So lift in the sense, right now you are using a different dressing. You are not using Tegaderm. You are got a different IV dressing. But lifting means, now suppose I have used this dressing. Okay, I am applying the strips on the wings of the carrot. So I apply it on one wing, then I put it on the other wing, parallel to each other. Visibility of my insertion site should not be compromised. Then I apply my dressing. So whenever I apply my dressing, it's important my site visibility should not be compromised. Right? So edge lifting means what? Now I have done this. So when I am removing this strip, my edges should be secured properly. So if I do not secure my edges properly, what will happen is it will start loosening from here. And once it starts loosening, if you apply tape, does it solve the purpose? No. It will keep coming off. So this securement is very important. So this is what you need to remember. Securement of the dressings have to be done very thoroughly. If the cannula is not secured, your dress cannula can have complication. Now, how frequently you observe the insertion site? Pediatric, every 30 minutes to 1 hour. In adults, it is 2 to 4 hours, and in ICU every hour. Okay, so this is what is important to follow. When do you remove this dressing? Center line dressing means peripheral line dressing. Clinically indicated, which is whether you're changing the cannula or soil, if the edge is lifted, if there is blood stain, if there is moisture, you're not able to see the insertion site, you will change the dressing. Okay? When you remove the dressing, please don't use alcohols to remove. Use saline, normal saline, right, or a gauze, damp it, stretch the dressing, and the edge will become loose. Then, whenever you remove the dressing, it has to be low and slow. Low and slow. So low and slow means as low to the skin as possible. Also important here is that before you apply any dressing to the patient, please ensure you apply Cavalon. Cavalon is not only for central line, it's also for peripheral. Patient's skin is so fragile, the patient can have skin injuries. That's called medical adhesive related skin, MARC. So before application of any dressing, apply Cavalon leaving the insertion site. So you have one available in your hospital. So you just have to ensure you open, and this is an expired one. So you have to leave the insertion site and apply it around. Give 30 seconds to dry, and it will dry, and then you can apply the dressing. So it helps you to remove also the dressing easily because it's a film, not directly on the skin. What happens is the damage to the skin starts from the time you apply the tape. Okay? And as the days go by, the tape strongly starts becoming a part of the body. So if you apply a barrier, it prevents that sticking to get attached to the skin, directly causing a damage. So when I remove the tape, I'm not removing the skin or the first layer of the skin, you are removing that first layer of the gap. Okay, that's why it's important for you to apply. Okay, so this is important part. Other than this, if a line is inserted in emergency, you don't know whether a septic precautions are followed or not, then you need to label that line inserted in emergency, and that line has to be changed within 24 hours or 48 hours because first objective is to save the patient's life, but second objective is to ensure patient does not get infection. So to prevent that infection, you have to remove that line at the earliest. It's only also for central lines. Okay, so this is what you need to follow as a part of the practice. Any doubts? Any doubts? Okay, you can move to the central line station. Everybody finished the PTEST? No? The case of please complete the PTEST. Post-test will be sent as a QR code to you. Link will be there. Those who have not got the PTEST, will please finish it and move to the
Is it particular?
Central Line Station. And once you finish the Central Line Station, there is a QR code for certificates. You can that. क्या हुआ?